SNAP-E&T. On today's webinar, you will hear from several experts on how state and local communities can capitalize on the SNAP Employment and Training Program and take advantage of new opportunities. You'll also hear about some best practices that are highlighted in National Skills Coalition and Seattle Jobs Initiative's recently released report. For those unfamiliar with National Skills Coalition, we have a vision of an America that grows its economy by investing in its people so that every worker in every industry has the skills they need to compete and prosper. We do this by organizing broad-based coalitions seeking to raise the skills of America's workers across a range of industries by advocating for public policies that invest in what works, as informed by our members' real-world expertise, and by communicating those goals to an American public seeking a vision for a strong U.S. economy that allows everyone to be part of its success. We've got a lot to cover today, and we want to make sure we have time for everyone's questions. So without further delay, I'm pleased to turn it over to Rachel Gregg. Rachel?
Thanks, Angela. So I'm Rachel Gregg. I'm the Federal Policy Director with National Skills Coalition, and I'm going to take just a few minutes to give a little bit of an overview of SNAP-E&T. Before I start talking about the content, though, I do wanted to say Angela Hanks, who opened the call for us, she is going to be moderating questions. We're going to wait until the end of the webinar to take questions. But if you have questions as we go, you can type them in. You'll see on your screen there's a little place where you can type them in. And if it's something that Angela can answer while we're going, she will try and help you with that. Or she'll make sure that we get you an answer before we get off the call. So please feel free to go ahead and send us your questions as we're going. So I just want to thank everybody who's on the call listening and everybody who is on the call talking today. Ed Boland from the Center on Budget, Laura Rowley from Seattle Jobs Initiative, and Rick Krause, who's working with Seattle Jobs Initiative in Washington State, and Dr. David Stout from South Carolina, the director of the adult education program there, are all taking their time to be on this call to help us understand a little bit about what you can do with SNAP-E&T and to talk a little bit about what both Washington and South Carolina are already doing with SNAP-E&T, and hopefully will help people start to really think about what your states can do with SNAP-E&T as well. Some of you have probably heard me talk about SNAP-E&T. I have been talking about SNAP-E&T for quite a few years now. I am a big believer in this program. I think it has a ton of potential, and it's a really important workforce development program, or a potentially very important workforce development program. We can't lose sight of the fact that it is part of a larger nutrition program, and Ed is going to talk a little bit about how it sort of functions inside of SNAP. But I want to talk a little bit, since most of the people on this call come from the workforce development field, I want to talk a little bit about SNAP-E&T as a workforce development program. I really do believe that SNAP-E&T has the potential to be this very important component in a statewide workforce development system, particularly as we start to think about workforce development more broadly and try and connect across systems and align programs. I think SNAP-E&T can be an important connector across programs that serve very low-income, low-skilled people, connecting them to the broader workforce development system. SNAP-E&T has the potential to bring new sustainable resources into the system, and I can't really overstate how important that is, because in general we have seen significant declines in funding for workforce development, especially for programs that serve very low-skilled people. And I think part of the power of SNAP-E&T is the fact that if states can figure out how to do this correctly, you can really leverage investments that you're making already around workforce development in serving the SNAP population. States are leaving money on the table right now, just to be frank, and that is terrible. When we are begging for pennies here in D.C., you should not be leaving resources untapped. So it takes a little bit of startup costs, a little bit of investment of time and resources and energy to figure out how to use this program well and how to serve SNAP recipients well, but I think it's time well spent. Particularly because you can serve a population that is often not well served through other programs for a bunch of different reasons, including a lack of resources. It can be just very, very difficult to make the kind of investment of time and resources and supportive services, particularly for people who don't have good work history, people who don't have strong workplace skills, who don't have strong occupational skills, who need adult basic education or other remediation. That's a hard population to serve, and I do think that this SNAP-E&T lends itself well to being a part of the solution for this problem. Jem, can you go to the next slide? So not only do I think it can be part of a good, aligned system, I think SNAP E&T is actually a smart workforce program. If you actually set out to design a job training program for low-skilled, low-income workers, I think it would actually look a lot like SNAP E&T. It allows for robust supportive services. It lends itself for articulated career pathways. It can serve well as a bridge between programs. So if you have people in your state who are transitioning off of TANF, the cutoff, the income eligibility for TANF, of course, is quite low. People tend to still be eligible for SNAP after they exit TANF, though. So you can use SNAP E&T, for example, as a bridge for people moving off of TANF and to help them bridge into WIA or Pell and across institutions. So we'll hear from Washington State. They've been very successful in using the program to help bridge between community-based organizations and community colleges. There are reporting requirements now for SNAP E&T. That was a change that was made under the most recent Farm Bill. But they're good reporting requirements. Anybody who works on job training programs is already sort of very used to reporting requirements and making sure that we're collecting data on outcomes and how well we're serving people. SNAP E&T did not used to have those kinds of performance measures or reporting requirements at the national level, at the federal level. We do now, but the ones that were created in the Farm Bill actually take into consideration the kinds of obstacles and barriers that SNAP recipients face. It allows for the sort of longer-term timeline that you have when you're serving very low-skilled people, and it recognizes some of the challenges and barriers that a SNAP population might face. So it's not just that I think that this program can help fill in some of the gaps to help serve the SNAP population through your workforce development system, but I actually think that it's a good, smart program. And if you can figure out how to use it, you can actually provide high-quality training and supportive services, which is very important. This is one of the best strengths of SNAP E&T is that you can use the program to provide supportive services as well. So I just think it's not just a gap filler, but it's actually a smart program for serving this population. Can you go to the next slide? The challenge with SNAP E&T, and I think we have seen this, and I think people that are interested in figuring out how to do expanded, strong, skills-based SNAP E&T programs have probably run into this. So SNAP E&T is unique in that it's neither fish nor fowl, right? So it is a job training program inside of a nutrition program. It is probably run by your state SNAP agency, which is not a job training agency and should not be a job training agency. They need to make sure people have access to nutrition. But at the same time, those of us on the workforce development side should not just be treating it like it's an interchangeable job training program. It really does have particular characteristics that are unique to the fact that it is inside of the SNAP program, and for many people on SNAP, they need access to this program in order to maintain their access to their nutrition benefits. And people on the workforce side need to be conscious and aware of that as you're thinking about how to help people gain skills through this program. I really do think that the goal, as you're starting to think about a SNAP E&T program, expanding a SNAP E&T program in your state, if you are doing that, the goal, I think, should be to integrate SNAP E&T into a state workforce development system. It should not be separate. It should not be siloed. The SNAP agency should not be creating its own job training program. That seems like the worst case scenario. But if we can connect it to the existing workforce development system and really integrate it in a meaningful way, while recognizing the unique needs of SNAP recipients who are being served through the program and making sure that we're not doing anything that impacts their ability to get their nutrition benefits, I think, again, it can really be a core component of a workforce development system. The challenge there, of course, is that it really does require a high degree of cooperation and coordination across agencies. The good news is there's movement in this direction just in general in workforce development, but I do think in this particular case, you really have to take it very seriously and make sure that the right hand knows what the left hand is doing, because otherwise you can actually get into trouble if you don't run the program correctly. And I would say if your SNAP agency isn't talking to you, you should be talking to your SNAP agency. in a lot of places where we have seen this work well, it has started with people from the workforce community urging the SNAP agency to take a look at this program and figure out a way to work together. Can we go to the next slide, Jen? So here's the good news. There's a lot of new attention to SNAP ENT at the federal level and in the states. I think some of the attention is part of a broader interest at the national level in skilled workforce issues. We've seen this playing out in a lot of different ways. Congress, after just 11 short years, it looks like we are finally going to get WIA reauthorized. The administration has been very focused on skills. So we're seeing a lot of attention to skills in general. And I think that's part of what was driving this. There's also interest in just figuring out how do we make sure that people on SNAP have access to the skills they need to get a better job, to earn a decent wage, and ultimately, ideally, move off of SNAP. But like I said, I think it just reflects this broader dynamic in part where there's a lot of interest in skilling up the workforce. We have definitely seen an increased commitment to SNAP ENT at FNS. Undersecretary Concannon sent out a letter to the states earlier this year urging the states to really look at their SNAP ENT programs, really think about what they can do to make them stronger, and to really focus on increasing the skills of SNAP recipients so that they can move into stable employment and earn a decent wage for them to support themselves and their families. And that's a change. I mean, we have not seen a message or a signal like that go out from the agency before. They've also brought on new staff capacity, not a ton, and I know that the people who are doing it are stretched very, very thin. But again, this is the first time where we've seen that kind of designated staff capacity just work on SNAP ENT and to help the states think about how they can do more with this program. And then SNAP ENT, there's no question, it's this little tiny part of the SNAP program, which is a huge program, which is just a part of the Farm Bill. So this little tiny program, it did get a fair amount of attention in the Farm Bill debate. You know, it was part of this debate around what kind of expectations we're going to place on SNAP recipients. There was some effort to make SNAP look a lot more like TANF with time limits and work requirements. And I do think Congress, you know, really chose to, at least for now, use SNAP ENT instead of moving more towards a TANF-like model, really give states a chance to look at their SNAP ENT programs, think about are there things that they can do there to help SNAP recipients get back into the labor market, or if they're already in the labor market, you know, become more stable in the labor market or earn a higher wage. What is it the states can do to help SNAP recipients through SNAP ENT move more towards economic self-sufficiency? And that was an important part of the debate that we saw, and I think will be an important part of the debate as we go forward as well. And we shouldn't lose sight of that. So if you can go to the next slide, Jen. And the other thing that we saw in the Farm Bill, and again, I really can't underestimate or understate how important it was to see this happen. So we actually saw new investments in SNAP ENT at a time when we are losing investments in other job training programs, at a time when the bulk of the debate around the Farm Bill was how do we cut funding for these programs. To have this kind of new investment in SNAP ENT, I think really reflects a commitment to this program and an interest in seeing this program succeed that we should not underestimate. So $200 million in new pilot grants created in the Farm Bill. The statutory goal of these grants is to test new methods for employment and training programs and services to increase employment and earnings and reduce reliance on public benefits. And I will be honest, I just stole this bullet point from Ed from a PowerPoint that he did. But I want to make the point that this is a real change. We have not ever seen before this as a goal of the SNAP ENT program to increase employment and earnings and reduce reliance on public benefits. That's such a strong, important signal. Other things that are important under the pilot to the workforce development community. In order to get a pilot grant, the state SNAP agency must commit to collaborate with workforce boards and job training programs in the state. So this should not be happening in a silo. Like I said before, the workforce development field has a strong role to play in this conversation to really help shape these programs. And I really want to urge states to think about, states that are thinking about applying for a pilot, I really want to urge states to think about the pilots not as a standalone 3-year grant, because we've all done that where you apply for grants, you do something for a couple of years, and then it just goes away. SNAP E&T should be a sustainable program. There is funding through the 50/50 reimbursement. There's funding that you can use to build capacity over time in a significant way. So if you think about the pilots as like seed or catalyst money to really build a broader state SNAP E&T program that is in it for the long term, I think that's going to be a much more successful approach for your statewide workforce development system than if you just think about it as a 3-year grant where you try something and then it goes away. Can we go to the next slide, Jen? And so the last point I want to make is that I really do think that this is an important opportunity. There's a lot of interest in this program. I think states are going to be doing more with it. There's going to be more attention to it at the federal level, and it's going to happen with or without the workforce development field's input. And I think it would be a real shame if it went forward without us. So we've got to figure out a way to, if you're not actually invited to the table, you've got to find a way to figure out ways to bring yourself to the table and be a part of those conversations. And I think it's really important that we demonstrate that investments in skills is the right approach to helping SNAP recipients. We don't want to find ourselves in a situation where 5 years from now when we come back to the next Farm Bill, it looks like nothing happened and we didn't really move the conversation forward in any way, and that SNAP recipients are no better off now than they were, or no better off 5 years from now than they are right now in terms of their ability to earn a decent wage and be stably employed. I think if we can't demonstrate results, this conversation will move in directions that I think many of us who care about skills and occupational training would not want to see it move, where we go back to more like a work-first model where any job, to get a job, any job is the right solution. So I think it's, like I said, I think there's a real opportunity to influence these conversations now, and I think if we don't take advantage of that opportunity, there will be consequences in the long run for what happens with this program. And so with that, it's just a very quick, broad overview. We have some additional materials available. We emailed out these links, and we'll send them around again with the PowerPoint after we're done. But we do have a lot of materials available. You can also reach out to me at any point. My contact information will be at the end of the PowerPoint. But we really do want to be a resource, and we want to be as helpful as we can to states that are interested in doing this. So if you have questions or if there are things that you need, please don't hesitate to treat us as a resource. So now I'm going to turn it over to Ed Boland from the Center on Budget and Policy Priorities. He's going to talk a little bit about SNAP E&T as part of the broader SNAP program, so not just as a workforce development program, but really how does it interact with people's ability to maintain their nutrition benefits and meet the requirements of the SNAP program. So Ed, if you want to go ahead?
Sure.
Thank you.
Thanks, Rachel. Great. Well, first I'd like to thank Rachel and the National Skills Coalition for the opportunity to be a part of this. It's very exciting, and I see several hundred folks on the call, which might be a record as far as the number of people who are talking about SNAP E&T at the same time. I work at the Center on Budget and Policy Priorities, which is a national nonprofit organization that focuses on fiscal policy, budget issues, and programs that serve low-income and middle-income Americans. I work almost exclusively on SNAP, which is the food stamp program, with a little bit of work on health care and the Affordable Care Act implementation. And so I'm going to talk about E&T from the SNAP perspective and hopefully shed a little bit of light on how states might be approaching SNAP E&T and ways that you might be able to engage or increase your engagement with the SNAP E&T SNAP agency in the SNAP E&T program. I have 3 main points, so I figured I'd just put them right out there. And I'll talk a little bit more about each of these as we go through. But I think it's really helpful to keep in mind that, as Rachel had said, SNAP E&T is a part of SNAP, and it's sort of embedded into the nutrition program. SNAP, as you probably are aware, is the nation's largest nutrition assistance program. At its height during the recession, it was serving 1 in 7 people in the United States. It's still close to that level. We've seen a very slow decline in participation in SNAP. But what that means is SNAP serves all kinds of people. It's an extremely diverse program. It's an entitlement, which means if you qualify because your income and your other characteristics qualify you, you will receive assistance. What that has meant is over time, the program has responded in different ways to the larger economy and to the larger situation that people find themselves in. I think the underlying characteristic is people who need food assistance are poor. They have very little income. Some of them will be extremely poor, and some of the folks in a SNAP E&T program might be among the poorest and least skilled people. They may have very little work experience. They may have a lot of barriers towards being able to work and reach self-sufficiency. But at the same time, especially in the last several years because of the recession and the slow recovery, SNAP also serves a lot of working people. And I'll talk a little bit about that, people who are either currently working or who have a recent work history. And so a SNAP E&T program might be slightly differently designed to target those people and to try to get them the assistance they need to get back into the workforce. Another main point, which is I think unique to a nutrition assistance program, is that if somebody's participating in SNAP E&T, in a community program that receives its funding through SNAP E&T, and they are a SNAP participant who's there because of the E&T program, they can lose their food benefits if they fail to comply with the E&T requirements. So it's not just a matter of losing their place in a class or not getting their certificate that they were working towards, but if they were required to do something in the E&T program and they fail to do it, the state can sanction them. In other words, take away benefits for 1 month, 3 months, 6 months. States have a lot of flexibility. More so, a whole household could lose their benefits. So kids could be facing a loss of food assistance if a parent is unable to complete their employment and training requirements. And so that, I think, adds a dimension is when you're thinking of what can we do with E&T funding and who can we serve through the SNAP E&T program, it's important to keep in mind that for many of them, this could be a very critical link to a very, very basic need. And so you want to set up a program that doesn't cut them off or make it so impossible for them to participate that they might lose their food assistance. And then I think a third point is, how do SNAP agencies look at E&T? How do states run the SNAP program? They receive a lot of federal funding to do so, but they're ultimately responsible for participation, determining eligibility, and monitoring people's participation in the SNAP program. And so they'll also run their E&T programs. Some states will have dedicated staff that work on SNAP E&T. Some will have people who manage a number of roles, including E&T, as part of what they do with the agency. But they kind of come about it in 3 ways, I think. One, they might use SNAP E&T to basically test a SNAP participant's willingness to work. That would be sort of that work first, job search kind of a approach. And some of that will be driven by state concerns that people have been on SNAP too long, or during the recession when participation just skyrocketed, they wanted a means to be able to make sure that people were at least willing to work if there was a job available. You know, that whether or not job search is the best way to test the willingness to work, I think, is a question that the research would draw out. But that's how a state might approach it, is to say we want to run a job search or some sort of workfare type program because we want to make sure these people that are receiving food assistance would be working if they could get a job. Another main priority for some SNAP agencies, which is related to the first, is SNAP E&T might be a way to provide certain unemployed childless adults with a way to keep food benefits. SNAP has a work requirement for non-disabled childless adults. They can be limited in their food assistance to 3 months out of 3 years unless they're working or doing some sort of employment and training activity. So some states where that requirement's in place might be saying we want to funnel our E&T program to make sure that those people have a chance to keep their benefits. If they can't find work, we want to give them it's actually 20 hours a week on average. We want to give them a significant amount of employment and training activities so they can keep their benefits. And then I think a third category, some states look at employment and training programs as a way to actually improve individual skills and give them the abilities and experience to get a job. And I think that's probably most intuitive for many of the people on the call is what an employment and training program should be doing. Some states are doing a good job in trying to at least direct some of their employment and training activities for folks where the goal is to improve their skills. But I think it's helpful to keep in mind from a SNAP agency perspective, there might be a couple of different motives, and that might dictate what the SNAP ENT program looks like in a particular state. Next slide. So I thought it would be helpful to get a little context. Again, SNAP ENT is a part of SNAP, and people find themselves on the SNAP program after going through a rigorous application process. And once they're on the program, they have to actually register for work and meet certain requirements unless they're exempt. And so I listed these categories of the most common and the largest exemptions. Obviously, young children don't have to be work registrants. The elderly do not either. People who are disabled, and there's a special standard in SNAP. It's not necessarily just getting disability, being on a disability program. Caring for a young child, complying with work requirements generally in TANF, the Welfare Assistance Program. As you can see, there's a number of requirements. So if somebody doesn't fall into one of these exemptions, they have to register for work with the SNAP agency. They have to accept a job if offered one. If the state itself connects them to a job, they have to accept that job. They can't voluntarily decrease their hours if they are working. So there's a number of requirements that people have to meet in the work program. That has nothing to do with employment and training necessarily. It just applies to everybody who's not exempt. Next slide. And so it's helpful to keep in mind that most people in SNAP, most of that diverse population, are either not expected to work because they meet one of those exemptions. I mean, almost half of the people on SNAP are under the age of 18. It's in some ways a child nutrition program. And they're not expected to work. And then if they're disabled or elderly, they're not expected to work either. But as I mentioned before, the program is extremely responsive to larger changes in the nation's economy, and in a trend that's been sort of consistent over the last 10 or 12 years, an increasing number of people are actually working and still qualifying for SNAP. Their incomes are still low enough to make them eligible for food assistance. So many of them will be working part-time hours or erratic hours or in and out of the workforce, but they are getting earnings. And so if you think of them as already employed and you add to them the folks who aren't expected to work, you actually realize that 4 out of 5 participants in SNAP are either working or not expected to work. That remaining category would be the people that many states would target their employment and training activities towards. Next slide. So once you're a work registrant, the state can, if the state chooses to, assign you to an employment and training activity. State has a huge amount of flexibility. They can exempt additional people from having to do any employment and training. And some states have done that. They've exempted almost everybody and not had a very rigorous employment and training program. That's, I think, when Rachel said states leave money on the table. There are states that leave SNAP ENT funding on the table because they don't fully identify people that they can assign employment and training activities to and rather exempt them. In addition, the state can choose which activity, and I'll talk a little bit about the types of activities that states can provide under employment and training, but they can also decide whether to make it a mandatory or voluntary program. And that's an important distinction. A mandatory program is when the state says you have to participate in this ENT activity. If you fail to do so, you'll be sanctioned. That mandatory program is the kind of program where somebody could lose their food assistance if they can't make it to their training class or they can't complete the job search requirements. They can lose their benefits. A voluntary program, I like to think of it as self-initiated. The state doesn't assign anybody, but they say, hey, when you're applying, here's the employment and training activities that we can provide while you're on SNAP. If you're interested in any of these, we'll connect you to the service. You can get the skills you need. Voluntary programs tend to be the kinds of programs that try to build skills and provide certificates and other kinds of enhancements for people to be able to actually get a job. You're not likely to see something like a voluntary job search program. A job search is more likely to be a mandatory requirement. Starting in about 2007, states shifted from primarily running mandatory programs to many of them switched to running voluntary programs. Part of that was because there just weren't jobs out there during the recession, so making something mandatory didn't make a lot of sense. And they thought that providing some skills to perhaps a smaller number of people who were motivated to get those skills would be a valuable enhancement. And I think at one point it was over half of the states had at least some voluntary component. Again, since the economy is picking up and SNAP is responsive to these larger shifts in the economy, we're seeing states begin to move away from voluntary and back to mandatory. But that's an important distinction to look at when you're engaging with the state on its employment and training program. A couple of characteristics, not quite done, but I can just, thanks. A couple of characteristics of the employment and training program. If a state does assign somebody to an activity, they have to make some determination of what's the appropriate activity. And to be honest, I don't know how good states are on this. I think some states do try to match people to an actual activity. I think some states say, you know what, we offer job search or workfare. If we assign you to it, we've determined that's the right activity for you, whether or not it is. But it is a requirement, and I think it's one place to look and to think when you're working with the state to say, hey, especially if you have a mandatory program and you're requiring people to do things, we need to make sure there's a range of activities so that there's something appropriate for somebody who comes with a lot of barriers. There's something appropriate for somebody who has a recent connection to the workforce and just maybe needs some assistance to find a new job. We need to be able to slot people into different appropriate activities. Another unique characteristic of E&T, SNAP E&T, is that the state has to reimburse an individual for expenses that are reasonable and necessary to participate. And what that means is often transportation costs and, in some cases, child care costs, but also things like uniforms, some of the costs that an individual might have to participate in a program. If the state's going to require somebody to participate, they have to reimburse for those costs, which makes a lot of sense. And I think that's why Rachel sometimes says if you're going to design an employment and training program, I think this is one of those characteristics you'd love to see. If you're going to make somebody travel across town to take a class, you need to be able to make sure they get there. Otherwise, it doesn't really make much sense to assign them to the activity. And so SNAP E&T actually says if you need to provide that reimbursement, if you choose not to, then you can't assign somebody to the activity. And states are all over the map on how robust the reimbursements are and what kinds of things they'll cover. But it's an important thing to learn about in your state, I think, is what they're willing to provide or what they would be willing if you're able to explain why a particular expense is necessary. And then, as I mentioned earlier, an important characteristic of SNAP E&T is that if you're in a mandatory program, an individual can actually lose their food benefits if they don't comply. Always important to keep in mind. That's why I said it again. It's not only can it be the individual, but as I mentioned, the whole household can be sanctioned, and the state has a lot of options, as they do throughout the SNAP E&T program, as to how harsh that sanction is, whether it's just the individual, the adult, or the whole household, and how long the sanction is. Again, I mentioned this other group of people. These, in SNAP, they're called ABODs, in case you hear that term tossed about. That stands for able-bodied adults without dependents. But basically unemployed childless adults who are not disabled, face this very strict time limit for benefits. So the only way they can meet that is the only way they can receive benefits for more than 3 months is if they're working or in an employment and training activity for 20 hours a week. That's a big chunk of time, and it can be expensive to provide depending on what those activities are. So again, that's one reason states were very focused on certain kinds of activities if, in fact, they had childless adults subject to this time limit. During the recession, actually, ever since this was put in place in 1996 during the welfare reforms around cash assistance, and there has always been a waiver for areas or complete states where there's been an insufficient amount of jobs or high unemployment. So states have been, and again, it's a state option, whether they want to waive this requirement or not. But during the recession, starting in about 2007 again, almost every state waived the entire state from this requirement. So that's, for one thing to keep in mind is that for some states, they haven't thought about this requirement in 7 years because they've been waiving this population. But in those states where the economy has picked up and their unemployment rate is dropping, they may not be eligible for statewide waivers or even smaller sub-state waivers. And so for the first time in many years, they're beginning to realize they have this very complicated administrative requirement. They have to track the months. They have to figure out if somebody's working 20 hours a week. It's very complicated. And it makes them nervous because they could make errors, which they can be penalized for. But it also means they may be refocusing their efforts to this unemployed childless adult group. That's not a popular group politically, so it's often, the approach is often sort of a job search, give them a chance to do work there for 20 hours a week, and if they drop off, that's too bad, they weren't willing to work. So states might be thinking about this group, and I think it's to the degree that the workforce community can say, hey, we can serve those people, SNAP E&T can be a part of how we serve those people, we can actually give them skills to get jobs, would be very valuable for states to hear, because their default might be a more workforce-first approach, which before the recession essentially meant people dropped off of the SNAP program. Sooner or later, they couldn't meet that requirement through job search, and they lost their benefits. Next slide. So I listed the activities under SNAP E&T, relatively comprehensive, and I pulled out the numbers of participants just to show you. This was in 2011, I think, just to show you where states are focused. Obviously, 55% of all people in employment and training activities in SNAP are doing job search. Another 11% are doing workfare. Job search training is another 7%. When you start looking at things like workforce investment activities, job retention, which allows SNAP E&T to pay those necessary costs like transportation and uniforms for people after they get work, which is a great option and is relatively recent, so states might not be aware of it. It's not too many states are doing it. We would love to see more states doing it because we think it might be a critical way for people to actually keep their jobs. But you can see that those kinds of activities, training, job skills, are a smaller part of what states are currently doing. We're hoping that they beef up those programs, and I think connecting with their workforce partners would be wonderful, because in some states they don't really have those connections. Next slide. And so I thought I'd also just include a little bit about the funding. I'm not sure, you can see at the bottom there, the total federal funding is about $362 million. I don't know how that racks up in the employment and training world. Keep in mind that SNAP is a $80 billion a year program, with 95%, more than that, 95, 96% of that going straight to food assistance. It's the actual, money on the card that they spend in grocery stores and supermarkets. So SNAP E&T is tiny, tiny, tiny as far as the state's obligation to run an enormous program. But it is a significant amount of money. And just to run through it, every state gets a federal grant. So every state knows that they're going to get a certain amount of money. Some states leave that money on the table. And I think certainly you'd want to make sure that states are at least using the essentially federal grants to run some kind of a program, even if it's a very small targeted program. Then states get 50% reimbursements for additional expenses. That's uncapped. So if a state puts up 50% of the costs for more programs, 50% of the reimbursements for people to participate, the child care and transportation costs, whatever, the feds will match that or reimburse 50% of those costs. Some states use a significant amount of this 50% reimbursement. Some states use very tiny amounts or almost none. But it's enticing. It can be, doesn't have to be state dollars. It could be philanthropic or other matching funds. And then the other costs I just put out there. You'll see a line down there, ABOD pledge states. Those are the able-bodied adults who face the time limits. States can pledge to serve those people, which means they will guarantee at least an opportunity to participate. And there's like 5 states that do that. They get an extra piece of a $20 million pot of money. And then next slide. So as Rachel had mentioned, the Farm Bill not only included some outcome measurements for SNAP E&T, which is exciting, and I think it's helpful to keep in mind from a state perspective that if they've been operating the E&T program, they've been responsible to report to the FNS, Food and Nutrition Services, the federal agency that runs SNAP, what they spend on E&T and how many people they serve. So it's their engagement on reporting has been primarily like an accountability measure. Did they reimburse people correctly? Did they make sure that community programs operating a E&T component, a SNAP E&T component, use the money correctly and didn't supplant, local funds with this federal dollars coming in. It's all been accountability on the fiscal side. The Farm Bill has these new measures that actually says, well, you got all this money. Did people gain skills? Did they get jobs? That's something that's exciting in SNAP. And then these pilot projects, which are on a shorter timeline than the new measurements, are also exciting because they are new money. And from the SNAP perspective, we're excited about the E&T pilots for the reasons that I sort of state here. It will allow states to reach new populations. A lot of folks on SNAP don't get any kinds of employment and training services, but might benefit from them if the state had additional resources and was really committed to identifying who might be eligible and likely to benefit from it. It's also coming at this time that because the recession's improving and these waivers for the single adults are dropping off, states are beginning to look back at employment and training. And again, as Rachel mentioned, the federal government is starting to focus on it. The undersecretary sent out a letter. And that's interesting to think about because in some cases states got that letter and said, oh, we got to do job search. We got to assign some more people to job search. That's not exactly what we think reengaging on employment and training should be. But again, it shows that state mindset, like, oh, employment and training, we're supposed to do something around work for these folks. What do we think of? We think of workfare and job search. And that's why I'm excited to see so many people from the workforce side to say, well, there's a lot more out there. Maybe some states can start to think about other ways of engaging their population in more productive activities. And then finally, we honestly don't know much about SNAP E&T. We don't know what works and what doesn't work, to be honest. We glean from other programs, what's the record on job search, what's the record on, a more comprehensive pathway to services, but we don't really know much in E&T, and so the pilots have a big evaluation component, and we're very excited to actually learn something about the SNAP population, the SNAP E&T program, that will lead to what we hope is further improvements in what E&T can do for SNAP folks. So I will wrap it up there, but I'm excited to hear and have a conversation about SNAP E&T.
Thanks very much, Ed. So now you've got a little bit of an overview of the program and how it interacts with a larger SNAP program. We're going to hear from two states, South Carolina, where they're using it with their adult education system, and they're relatively new to the experience, and then Washington State, where it's a big statewide program that they've been working on for a number of years. So we're going to start with South Carolina. So Dr. David Stout, who's the director of the adult education program there. David, if you want to just go ahead.
Thank you very much. I appreciate it, and we appreciate this opportunity to share what we're doing here in South Carolina. I've been involved in adult education since 1982 on the local level and here at the State Department since 1987. And everybody that I've worked with feel this has been one of the best and most successful programs that we've been involved with in a long, long time. And basically it started in 2012 when a consultant that was hired by the director of the Department of Social Services here in South Carolina, who handles all the SNAP activities, approached us and asked us about the possibility of joining in with the employment and training initiatives. And so we held basically a series of statewide meetings, meeting with all of our adult ed directors, bringing in people from our technical and community college, community-based organizations. The Department of Social Services was trying to cast a wide net and, not just narrow down, just to adult ed or just to community-based groups, but they wanted to share the goals that they had with all the education programs around the state. So basically, after about a year of working and negotiating, we signed an MOU and kicked off our initiative July 1st of last year, in 2013. We have most of adult education in South Carolina runs through the public school districts. We have 50 school district programs. We have 5 community-based programs and the Department of Corrections. And 48 of the 50 adult education programs decided that they were interested in this initiative, and they signed on. The goals of adult education are, to improve the educational level of the people that we serve, and will will lead to better employment, so they can make a livable wage and, be able to provide for their family. And in most cases, based on our data, our programs were already serving a good number of SNAP-eligible people. We worked with the Department of Social Services and did a data match to kind of prepare our districts to let them know what they could expect. And we found anywhere from 20% all the way up to 60% of our adult ed students in some counties were SNAP eligible. So those students were there. They were already coming to our class. And so we really didn't have to do anything out of the ordinary. We didn't have to run a big recruiting campaign or anything like that. The people were already coming to our program. So like I said, we kicked things off last July. And our programs are being reimbursed for a couple of different categories that's already been mentioned. The direct services, when you directly provide something for a SNAP recipient, then you're able to get some of the cost reimbursed, and also through the 50/50 reimbursement. And that's where on a monthly basis we do a data match with the adult education enrollment, and then the Department of Social Services provides the data match of their eligible clients. And basically, if an adult ed student attends at least 1 hour a month, and during that same time period they are eligible for the SNAP funds, then they're eligible for our programs to claim claim them for reimbursement. Probably the biggest use of our SNAP money that we've gotten so far has been put back into the adult ed programs to provide expanded transportation and child care. And that is the two biggest factors that will keep any adult education student from participating. They may be able to get a ride or somehow get to the adult ed program, but the rest of the time they're there, they're worried about how they're getting home. So some of our adult ed programs have been able to sign contracts with local transportation agencies to run buses through some of the neighborhoods or subdivisions, or even in the rural parts of the county, to pick up the individuals that would not have a way to get to adult education. And also the second part of that is the adult students that have small children. They can't, unless they have child care, they can't participate. So our programs have been able to expand child care services, not just for the SNAP recipients, but also for all adult education students. So it's helping everybody that's participating in our program. Each of our adult education programs has an employee that we call a transition specialist. And they may vary from a part-time person working maybe 8 or 10 hours a week to a full-time person in a larger school district. And that individual's main goal or main job responsibilities is to provide help to our adult ed students as they prepare to move on to the next step after they leave adult education. We spend a good deal of time working with all of our candidates, not just the SNAP candidates, on job seeking skills. Our transition specialists arrange job fairs there in the local adult ed centers. We work with college admissions people. We help our adult ed students with filling out financial aid. We take them on campus tours, and we bring in military recruiters. We're doing all that we can do to try to help our students so when they leave our program, they're either better prepared to get a job or go on to higher education. So a lot of our adult ed programs are using the SNAP funds that they're being reimbursed to expand the hours of those transition specialists so they can work with daytime students, nighttime students, students that come to adult ed just on Saturdays. That individual is really the go-to person for the adult ed students. They get to know them, they become their best friends, and sometimes they need a pat on the back, sometimes they need a kick in the seat. But we're there to help them move on to the to the next step. And was mentioned in the last presentation, the SNAP recipients can either come to our program as volunteers, which a good many of them do, but also the mandated people that have to come in and participate, for the 20-hour programs. One thing about a lot of our small rural programs, they do not have the finances to offer at least 20 hours of instruction a week for their adult ed programs. So they work with the local DSS office to make arrangements for whatever hours that the students cannot get in adult education. Then they will be assigned something else, either some job seeking or job training program with another provider, so they can get up to the number of hours that they really need to qualify. But the main goals of our SNAP program has, we've been concentrating on improving the basic skills of our students. We serve about 45,000 what we call fundable adults each year in our program, and about 40% of those students read below the 5th grade level. And of those reading below the 5th grade level, another 60% of those are probably 3rd grade level or below. So our programs have the challenges reaching out to these low-level learners. Our high school preparation program, whether it's working toward the GED test or the South Carolina High School Diploma, that's a major goal. But probably the biggest key that we are concentrating on with the SNAP recipients is the National Career Readiness Certificate Program. And this is a national credential based on the WorkKeys test. South Carolina has always been a national leader in the WorkKeys initiative. We started since 2005, and since then we've issued over 200,000 career readiness certificates to our population. And South Carolina is 3rd behind Georgia and Michigan for the number of career readiness certificates that's been issued. So this is such an important program. So many employers are going to the WorkKeys as a pre-screening process to determine, the skills of the candidates. And if we can get as many of our adult education students, at a high level, it will give them a better chance of getting a job. And lately, South Carolina has had some pretty significant job announcements. We have a Boeing factory in Charleston, South Carolina, that's been there about 2 years. I think basically we're becoming known the tire capital of the world. We've got about 5 or 6 major tire businesses that are now in South Carolina, and there's a lot of jobs opening up. So we are really concentrating on getting the adult education students ready to get some of these jobs. We've always tied adult education to economic development in South Carolina, and so we've been getting pretty good support financially from our General Assembly with our adult education funds. Mentioning some of the financial reimbursements that our adult ed programs are getting, we have filed 2 claims so far for funding from the Department of Social Services. The first claim was over $800,000, and the second one over $900,000. I mentioned this fact last May at the National State Directors of Adult Education meeting in Washington, D.C., and before I left that day, I had 25 business cards from other state directors of adult education that wanted to find out about how they could get involved in SNAP, and so I was very glad to share that with them. Just wanted to share briefly a little success story. We ran a report in April. I wanted to make a presentation to the SNAP officials here at the Department of Social Services to give them an idea of how things were going. And from July 1st of 2013 to March 31st, we served almost 10,000 SNAP-eligible students in our adult education program. And those 10,000 students accounted for almost 570,000 hours of attendance in our adult education program, which is pretty significant. And during that same time period, we had 1,086 SNAP recipients pass the GED test. Another 108 earned a South Carolina high school diploma. And I mentioned earlier the career readiness certificate. We had 1,868 SNAP recipients, which earned a career readiness certificate. And of that 1,868, 62% of them earned a minimum of a silver. And the silver level is pretty much the standard that most employers are looking at. if you can earn a silver level WorkKeys credential, then you pretty much have the potential to be able to show that you have the skills for about 85% of most of the jobs, the entry-level jobs in South Carolina and around the country. And as I mentioned earlier, this initiative that the Department of Social Services has is spread out not just in adult ed with our technical colleges, our nonprofits. It's a very coordinated effort, and we are really pleased with what's happened this first year, and we're currently fine-tuning everything for this the year that's just now started on July 1st, and we are looking forward to another great year here in South Carolina working with the SNAP program.
That's great, David. Thank you so much for sharing that experience with everybody. And it's great to see more states starting to work on this program. We're going to hear from one more set of speakers, Laura Rowley and Rick Krause from Washington State, which is sort of the big boss SNAP E&T program. They've been working on it the longest, as far as I know, and are really clicking along now. So, Laura and Rick, if you want to talk a little bit about Washington State?
Yeah, sure. This is Rick Krause. Thank you for the opportunity for sharing information about our program. You can show the next slide. The Department of Social and Health Services in Seattle-King County first learned about the potential for an expanded SNAP E&T program in 2004. At that time, we were working on a partnership with the local Annie EKC Making Connection site, the White Center community, which is one of the poorest communities in the state. Like most states at the time, we were running a small E&T program based on using a portion of the state's 100% fund allotment to provide what was basically a compliance program for mandatory populations of food stamp recipients. We learned about the potential for third-party match funding and the opportunity for leveraging the limited resources to expand access and understand to the underserved low-income adults and families who are receiving basic food benefits. And that's what we call SNAP E&T in our state, basic food. This was a population that was significantly limited with accessing critical employment and training resources. Supported by a number of key state agency and community champions, a work group was developed to explore the program's potential and to develop a business plan that could be presented to senior leadership in the state prior to pilot approval. The chart that we're showing reflects the key steps in establishing the pilot, the formation of the planning group, which was built on an existing collaborative, and included key staff from state agency, community partners, and the 4 community-based organizations, CBOs, and 1 partner college that provided services during the first year of the pilot. The success of the VFEP program can be directly tied to its being built on a collaborative partnership between the state agency and the initial partners that resulted in the launch of the pilot program in October 2005. Next slide, please. So how we grew, by design, we started small with a partnership of 4 CBOs and 1 college. This allowed the partnership to develop and continuously improve the key supporting program policies and processes. As part of our business and strategic plan for growth, we also wanted to ensure that we were in alignment with the state and program partners' administrative resources available to support effective program management as the program expanded. This measured growth allowed for the further development and improvement of the supporting referral, eligibility verification, participation reporting, and invoicing processes. This, over time, helped streamline those processes and in fact, reduce the administrative burden. So this chart reflects the strategic growth with new community-based organizations and colleges being added each year, and expansion from the initial service area to a statewide program with services provided by all of 34 of the Washington Community and Technical Colleges and by 29 CBOs.
Next slide, please. Laura here from Seattle Jobs Initiative. Thank you for having us. We were one of the original agencies in the pilot, and I wanted to talk a bit about the benefits of VFET to an agency like us. At SJI, we work in partnership with the area's community colleges, and we have the same goal: get people skills and a credential so they can get a better job and a career and become independent of subsidies. Through SNAP E&T, or as we call it in Washington State, VFET, we have been able to leverage our dollars and strengths. The colleges do a great job in getting people skills training and building career pathways where the participants can stop in and out of training and jobs. And we, through a network of community-based organizations, build on our expertise of recruiting people from the community, getting them ready for college, providing wraparound services, including crucial support services, and getting them into jobs and careers. We've been able to provide more services to more low-income, low-skilled people. BFET has allowed us at SJI about a 38% increase in the number of people and services. The other wonderful aspect of SNAP ENT is the fact that you can use the workforce dollars to serve anyone receiving SNAP. They don't have to be a specific population like youth or dislocated workers or refugees, but can include all of those populations. From SJI's perspective, it has been highly beneficial to have the colleges focus on serving more low-income, low-skilled people better. Compared to before our state had BFET, the colleges now have more student services, have mandatory new student orientations, include community-based organizations and workforce intermediaries in decision-making, and are tracking their outcomes beyond completion to include training-related job placement. I can't fully emphasize the collaborative benefit portion of the program. The state has been very inclusive on decision-making and continuous improvement. All entities have an equal voice at the table, which has led to multiple formal and informal partnerships across the state and lots of sharing of information. Next slide, please.
So part of the mission for Washington Colleges is to provide access to the critical basic education and skills training programs low-income residents need to support themselves and their families. BFET provides the colleges an opportunity to leverage state and local funds as match to fund tuition, books, support services, and fund dedicated BFET staff on campus to support students. For low-wage workers still eligible for BFET, or basic food, BFET supports the ability to provide access to wage and skill progression needed to move to self-sufficiency. This includes those low-income families who are formerly on TANF or who potentially may need to go back on TANF if they don't access the needed education and training services. For those students who are eligible for federal financial aid, BFET funding is utilized as a bridge to cover the cost of tuition, books, and fees for 1 or 2 quarters until the student receives a Pell Grant. However, after they receive Pell, they can continue to remain BFET students and receive BFET college staff support and possibly support services. There was a recognition from the start of the BFET partnership that there are key roles for both of the colleges and the partner community-based organizations with moving this population forward. When possible, there's a goal of co-enrollment, so participants receive not only the needed education and training, but when appropriate can receive the wraparound case management and support services that directly contribute to training, retention, and job placement. For low-income families, BFET provides access to Washington subsidized child care while they attend approved BFET training programs. And BFET approval also means full-time students can access basic food benefits, which is a key student support for this low-income population. Next slide.
Here are our goals. I hope this slide is clear, but let me touch on a few points. Jobs. We are all measuring entered employment and also looking at who gets off of subsidies because they no longer qualify due to higher income. Skills. Community colleges provide most of the skills training, but we do have some organizations, mostly social enterprises such as Goodwill and Fair Start, that provide skills training too. Better outcomes. We have performance-based contracts and also are looking at our data outcomes over time. We all live in the spirit of continuous improvement. Partnerships. BFET encourages co-enrollment between the colleges and CBOs, as you have heard. And because BFET is a collaborative, not directive program, many positive partnerships have grown organically. And of course, we are trying to collectively move people to self-sufficiency. Next slide, please.
So early in the pilot, we developed a program evaluation model to track program outcomes. We utilized our shared electronic case management system to track quarterly enrollments by provider, the specific program components provided, and to support a cross-match with the UI wage data to report program outcomes. In addition, the colleges track and report student outcomes utilizing their student achievement reporting system. This program evaluation data is utilized to provide ongoing quarterly outcome reporting to Food and Nutrition Services and for an annual report to the Washington State Legislature. The Annie E. Casey Foundation commissioned 2 reports to study BFED outcomes. This slide contains some of the key measures that were reported and reflect the significantly positive outcomes for program participants. However, it should be noted that the cohorts tracked in these reports were engaged in BFED during the recession, and more recent reports reflect improved outcomes. The BFED partnership is able to utilize the positive program outcomes to reflect the return on investment of resources and to help develop and maintain broad program support from key stakeholders. Next slide.
Some of the key lessons learned that we have, more can be found in the comprehensive report that by Rachel Gregg and David Kaz called Replicating Success, but I'll touch on a few. SNAP ENT can be a very flexible program, and we chose to place skills at the center and have a voluntary program to help fulfill our goal of moving people towards self-sufficiency. BFED community colleges and community-based organizations utilize local labor market data along with formal and informal partnerships with employers to ensure that they are aligned with broader labor market opportunities and that our training programs are designed to provide participants with specific skills that local employers want. Look at your local workforce development system and identify what is missing. Washington State's BFED program filled its gaps by increasing numbers served and placed into jobs, filling in tuition and book funding gaps, and increasing partnerships with a career pathways system. We started small and had planned growth. Doing that allowed us to work out the kinks of the system when it was small and strategically plan growth around the state and build partnerships. Use a collaborative, not directive approach. Our state government did not design the program in isolation and then ask for prospective service providers to apply. Instead, we designed and implemented the model in collaboration with existing local partnerships. It is designed as an equal partnership between the state, community colleges, and community-based organizations. So this concludes our little presentation.
Thanks, Laura and Rick. So we are pressing up against the end of our time, and I apologize that we didn't leave enough time for questions, but we can maybe take a couple, and if we don't get to your question, Angela has been tracking them, and we will do our best to answer them. Even if we don't get to answer them on the call, we'll try and get an answer back to you. Or if we don't, you'll see if you go to the next slide, there's my contact information. So if you have a question that we don't get to or you don't hear back from us, you can always email me, and I will do my best to get you an answer. So let's just take 1 or 2 quick questions.
All right, we're going to open it up for questions now. If you have a question, please raise your hand, and we will open up your lines one at a time. Or you can type a question into the question box. So I see we have a question from Mary Beth McCarthy. So Mary Beth, you can go ahead. Mary Beth, are you there?
Oh, I was just typing it in. So I know that we were tracking at one point outcomes for lots of different pieces of the program, but I'm just wondering if we've been tracking the number of people going off food benefits as a result of the program.
Yeah, hi, this is Rick. Yeah, we were doing some of that work as the next phase of the evaluation model. And so, yeah, we had some preliminary data of decreased dependency on benefits, but they're still working through that and developing those data sources.
Okay, thanks, Rick.
Uh-huh.
All right, our next question is from Diane Smith. Diane, I'm opening up your line. You can go ahead.
Yes, I was curious, is there a requirement for folks that are participating in a voluntary program to be reimbursed for their expenses as well?
This is Ed. Yes, if it's a voluntary program and somebody chooses to participate, if they have expenses, the state is required to reimburse. or exempt them from participating. So it's a little semantics, I guess. You know, if the state says, hey, we don't want to provide child care to people, it's a voluntary program. If you want to participate and you have child care costs, we're not going to reimburse you, but we can't sanction you. You know, we can't do anything about the fact that you're not able to participate. But a state that has a voluntary program often is thinking, we want these people to get these services, so is there a way that we can provide the child care and the support services to make it happen? If they run out of money, they may cap the program, essentially.
This is David in South Carolina. What we have done is we have waived all the fees for all the SNAP recipients.
All right, our next question is from Dolores Wood. Dolores, I'm opening up your line. You can go ahead.
Sorry, that was an error.
All right, no problem. Next question is from Thomas Jones. Thomas, you can go ahead.
Yes, my question is, since for the SNAP program we're talking about performance-based funding, what kind of testing are we using for the students? If you're using, for example, CASAS, if they're on a third grade or fourth grade level, you may have adults in there who are mixed in with ESL students, and the native-born adults are not going to be happy to be mixed in with the ESL students. Maybe some of these states are not using CASAS. What kind of assessment are you using? Because I'm sure that the funding is based on the assessment and the outcome of the assessment used.
So at the federal level, the funding is not performance-based. There may be some states that make that choice, but federal funding is not performance-based. I don't know about if South Carolina or Washington State, if you want to talk about it.
Well, we are a TASE state, and we use the test of adult basic education for all of our English academic students, and then we use the best literacy test for our non-English speakers. Our funding formula is based on performance, but to participate in this program, you know, performance is not a consideration.
All right. Our next question is from Jeff Foley. Jeff, you can go ahead.
Hi. I was wondering if you track ages, and especially interested in people who are over 50 plus.
We do at Seattle Jobs Initiative.
I believe our Department of Social and Health Services in Washington can provide that kind of data on demographics, because we've broken out the population before to see how many different ages of folks we're working with, how many had children, etc. So we do have that data available.
Okay, good. Could I just ask a follow-up? If somebody's on CSEP, are they eligible for this?
What is that?
If an individual is on the CSEP program, the Senior Community Services Employment Program, where they work 20 hours a week, trying to find a job, would they be eligible for this?
So, right, so CSEP is not a DOL program for seniors. In order to be eligible for SNAP ENT, you have to be receiving SNAP benefits. So if you have a senior who is eligible for SNAP, it's possible that the state could treat the CSEP activity as an ENT component, but that's sort of where you have to distribute and coordinate at the state level. You have to write it into your ENT plan and do some other things. But the linchpin is, if you are serving seniors who are eligible for SNAP, then they may be eligible for SNAP ENT, although I have to point out that people over, Ed, is it over age 65, are exempt from work requirements?
It's 59, but again, if you're running a voluntary program, someone who's exempt can participate.
Right. So there's a lot of activities that can count as the employment and training component. like Adult Ed, like what SJI does, their programs. No, none of these places created new programs out of whole cloth necessarily to become an E&T component. And that's, I think, part of the power of the program is you can take activities that you're already doing in your state, employment and training activities, and if you are serving SNAP recipients, if you can't supplant, you can't take money that you were spending as the state and replace it with federal money, but you can coordinate your programs in such a way so that as you bring new participants in or as you provide new services to those participants, you might be eligible, you might be able to treat it as a SNAP E&T component. So this is where you have to sort of do that work and have those conversations at the front end to figure out how you stitch together the SNAP E&T and the employment and training work that you're already doing. Does that make sense?
Yes, thank you.
Sure. So we are a little bit over time. If we haven't gotten to one of your questions, I apologize. We will try and get you an answer, though, if we can, or if you don't hear from us, like I said, just email me, and I will farm the questions out to make sure that we do get you the best answers that we can. So hopefully this was helpful and that states are starting to think about what they can do with E&T. I just want to thank everybody who listened to the webinar, and especially thank all of our presenters, Ed, David, and Laura and Rick. Thank you all so very much for sharing your expertise.